Welcome into this week's show, Between the Sheets, with Dr. Somini Uman. I'm your host, David Dunstan, and we're going to get into some different symptoms that women faced over the course of their lives. And, dive right in, Doc. Tell me what you want to talk about today.
All right. So when we talk about symptoms that women go through, the most common symptoms that you will come across will be incontinence. Right. And I know you have a story to say.
But that I always thought it was, I always thought incontinence was caused by laughing too hard.
That is called stress incontinence, you're right.
And it can do that, but there are other things too. I mean, you'd see the ads on television for the poise and the pads that women could, the undergarments, I guess is a better way to put it, what they wear. And I always thought, well, that was just women in their 70s that just can't control it anymore. It's not really that simple,
it's
is
not,
it?
No, it's not that simple. So you have something called the stress incontinence. This is where when the pressure within your belly increases, which we call as the intra-abdominal pressure, like when we are coughing and sneezing or when we are exercising, for example. There is no proper control of the urethra, right? It has to be tight and hold the urethra. But in some of us, it could be very weak, either because of the pelvic floor muscles being weak as well. And so when the pressure increases within your belly, you tend to leak. And that's why the underpads are important when it comes to that. But there is also something called as urge incontinence. This will happen when somebody has an overactive bladder. Just the filling of the bladder itself can cause the muscle of the bladder to start contracting, and then they have that leak. And so patients who wake up multiple times in the middle of the night could have what we call as urge incontinence. Mm-hmm. And some women can have a combination of these two, which is even more miserable for us. And that's called as mixed incontinence. And there's something called as functional incontinence. This is where either the patient is debilitated because of mobility issue, or they have some cognitive impairment, for example, and they don't really understand the concept of using the restroom, and then they can wet themselves. So those are called as functional incontinence.
And it's not just age that causes that. There's other factors that contribute to it, though,
yeah, right?
Like
age
what?
is an important factor. But patients who have gone through a pregnancy, childbirth, and patients who are in the perimenopause and menopausal stage, all of us experience the incontinence.
Okay, so I have a little bit better understanding of incontinence. Didn't really realize it was that involved, but okay. What are some of the other things that women...
There are a lot of other things that women go through. So we can think in terms of vaginal atrophy, where the health of the tissue is not optimal. Vaginal dryness leading to poor lubrication during intercourse, and painful intercourse, which we call as dyspareunia. Some patients will have a recurrent urinary tract infection or recurrent vaginal infection, so that's another issue as well. Some patients will have vaginal laxity, really lose vaginal tissue because of probably from multiple childbirth, for example. And so they can experience a very decreased experience with sexual intercourse, and naturally it can affect the partner's experience as well. And the other thing that we need to think about is the appearance of the external tissue as well, so that can change with aging as well.
So a lot of people don't know that there are more things you can do about that other than Kegel exercises and medication. And when we come back, we're going to talk about them right after this.
At Umamua MD, Spring Hill's newest physician-led med spa, it's about restoring balance to your body, mind, and soul. From weight loss support, revitalizing IV therapies, to anti-aging, our services are designed to help you feel renewed, confident, and whole. At Umamua MD, consults with our medical director ensure safe and personalized results. Book today at umamd.com and step forward radiant, restored, and confident.
just about to get into some of the things that actually can be done to satisfy some of, if not all of these symptoms in women. So tell us about the new and exciting things that you've got.
I'm so excited to bring or discuss this concept of EmpowerRF with you and with the world. It's such a revolutionary treatment that patients see a significant improvement in their very first treatment.
I have seen EmpowerRF described as women's wellness redefined. So tell us a little bit about what the devices that are used that come along with it and what they do.
So EmpowerRF is a revolutionary device. It's a state-of-art technology. It addresses almost every symptom that I discussed with you previously. It's safe, it's effective, it's an in-office procedure. It has 3 different modalities. The first modality is called the V-tone, which is nothing but electrical muscle stimulation. It's electromagnetic muscle stimulation of the pelvic floor muscle. So patients who have any type of incontinence, even functional incontinence, it helps with that. And so we have heard about Kegel exercise, right, to rehabilitate the pelvic floor, but we can only exercise so much, right, in a minute. So you can amplify this entire therapy 10,000 times with this device. We have had patients who have had just one single treatment and they've seen an immediate, positive effect from V-tone. Mm-hmm. So the second device is called as Forma-V, which runs on the principle of radio frequency. So we are literally heating the vaginal tissue using this device. And so when you do that, you're improving the blood flow or circulation to the vaginal tissue, and also it improves collagen and elastin synthesis.
Up on your screen right there is a picture of the Forma-V device. About how long does that appointment take and how many treatments do you need to see to be effective?
So most of the patients will require at least a minimum of 3 treatments. And not, forget that they will start to see improvement even with the very first treatment. Okay. And we personalize everything to what the patient's symptoms are. Sometimes, it's so complicated. A patient will have multiple symptoms. They're not just going to come with one symptom. In those cases,
severities.
Absolutely. So everything is personalized for that individual patient. So at least a minimum of 3 is what we recommend, and then they can always increase based on the actual outcome.
And it's in office. 30,
it's it's in office. No numbing or anything. If you want numbing, we can always do. But all you're going to feel is warmth or a heating. If somebody is scared, and if it's there, and we can always numb them for 10 minutes or so. We have a special numbing medication just for these procedures, and so we can do that. Or we can even do Pronox if they are. That's another option as well.
And the flagship, some people may have heard of, the Morpheus 8V,
yes,
is kind of the bell cow of these different things.
It's such a innovative treatment. So we have heard about radio frequency microneedling, right? And that's what this is as well, but for vaginal tissue. And so now we are actually delivering the radio frequency deep into the tissue, depending on the depth of the needle. So for this, we usually numb the patient for this. And the numbing will take, let's say, about 20-30 minutes, and then we start the procedure. The procedure itself is pretty quick, so it may take about another 30 minutes to 45 minutes. And so we not only are treating the inside of the vagina, we are also treating the external vulvar tissue as well. So you're changing or altering the appearance of the vulvar tissue, so to give that youthful appearance. And so, yes, you get multiple benefits from this.
Fascinating. We're going to take another quick break, and we'll be back to finish up with Dr. Uma right after this.
At Oumuamua MD, Spring Hill's newest physician-led med spa, it's about restoring balance to your body, mind, and soul. From weight loss support, revitalizing IV therapies, to anti-aging, our services are designed to help you feel renewed, confident, and whole. At Oumuamua MD, consults with our medical director ensure safe and personalized results. Book today at oumuamd.com and step forward radiant, restored, and confident.
welcome back. As you saw there on your screens, we're coming back the 3 devices for Empower, Forma V, V-Tone, Morpheus 8V. And Dr. when we went away, we were still talking about Morpheus 8V. That's a pretty intense treatment, but you have different things. And what we didn't talk about was Pronox. We actually have a Pronox device here. So if your pain threshold is a little less than some people, there are different ways to mitigate that as well.
Yeah, so we'll try to make sure that the whole treatment is as comfortable as possible. And for V-Tone, you're really not going to have any downtime. But for Forma V and Morpheus 8V, you will have a downtime of at least 2 days to a maximum probably like 7 days. You can have a little bit of spotting. That's pretty much it. And you do have to give pelvic rest during those days.
Yeah, and it sounds a little frightening on the surface. So far, everybody that's come into the clinic and experienced it, totally worth it.
It's totally worth it. It's so transformative. It liberates you from needing to wear a pad, or if you're really scared to go out on a date and you're just wondering when you will start leaking just by laughing, all that fear. I mean, when I really talk to my clients and when they come back and say after 1 treatment or 2 treatment, I mean, the recent patient, she said like 2 treatment, all her symptoms in that entire checklist resolved. I mean, it was just amazing, mind-blowing.
That is amazing.
And so it's a pretty safe and very effective treatment. And if people who are a little, scared, let's say, at least try it one time for you to experience it and see the improvement, and then you'll fall in love and you'll finish your entire series. We all age, so there's a high possibility you'll need 1 more treatment as a maintenance once a year at least.
Are there situations where maybe the specific client can benefit from more than 1 treatment, or maybe all 3?
Yes, sometimes I will combine treatment, and depending on the severity of the problem, we can actually do all 3 for a single client. Yes, and you're going to have like a very, the outcome is going to be just beautiful.
Yeah, and do you have packages at Umamua that combine treatments into one?
Absolutely, yes. So usually we sell these in packages of 3, and so when you do combine V-Tone with Forma V or V-Tone with Forma V and Morpheus, yes, we do have packages, and we will discount accordingly based on the number of sessions you buy and the number of treatments or type of treatment that you get. Yes.
And we're going to have an in-house gathering here in February 3rd. Here locally in Middle Tennessee. You might want to come out for that. There'll be lots of specials on those packages.
Absolutely, yeah.
Mix and match packages, maybe a chance to win a procedure, something like that.
Yes, I think that's something that we're going to do is people who attend, we are going to give a session of 3, any one, depending on their problem that they have, for free. So it could be V-Tone, it could be Forma V or Morpheus 8V for free.
So
we'll do a raffle.
That's going to do it for us this week. Thank you for joining us. We'll see you next week about the same time. Until then, I'm David Dunstan with Dr. Minnie. We'll see you next week.
Thank you.